And you know, how many doctors, primary care physicians, how many of them realize that it's a time issue, and or how many of them don't even think to recommend outside help other than just giving them a prescription and sending them on their way?
I think that's kind of hard to answer because there's the balance. I get the patients that I see that feel like, well, my primary care doctor doesn't do anything anyway. They just refer everything out. And again, I like to give the benefit of the doubt and think a lot of times that's not because their doctor doesn't care and doesn't want to help. It's because of the time constraints that these bigger, more time consuming topics as a primary care doctor, it's just easier to refer someone out to a specialist because they don't have the time to sit and spend.
Mhm.
Um, some of it is knowledge that, like I said, going through training, most doctors out there right now were not trained in their initial
Mhm.
schooling or residencies about menopause care or sexual health. I chose when I was in training, I spent time, I actually had an interest in this even back then. I spent a month with a urologist who does all sexual health. I took an elective month to go spend a month with him, um, and grow some of my knowledge, but that was only a month. And otherwise, in my training program, we had very limited education about this. And so it's not necessarily the fault of these doctors, but they weren't given the training and they don't have the time. And so I think that a lot of them recognize it and will refer out. Some of them don't even know they're missing it because they just weren't trained. They don't have the knowledge themselves. And um, again, I think that we sometimes get into the blame game, and I don't believe in that. I'd like to give the benefit of the doubt that it's just that they don't know. That's not that I'm saying that there aren't doctors out there who, aren't doing a great job. Of course, that's true in any field, but that's not helping patients get better by focusing on that. My focus is on finding the resources and helping them regardless of the reason. And so I'm not looking to blame another doctor or say that somebody did something wrong. I wasn't there. I don't know what happened. I'm about moving forward. And
Mhm.
so that to me is the most important thing is knowing how to move forward with patients and help them where they are and acknowledge what happened in the past and recognize it, but focusing on that and figuring out where to place blame doesn't help them. And so whether it be time, whether it be knowledge or whatever it is, I think that hopefully we are educating people more to refer out if they don't have the time or the knowledge and let people who do understand it and have the time manage these things.
Talk a little bit about, you're primarily working through telehealth.
Mhm.
So talk a little bit about that and how you establish trust for the from the patient standpoint of using telehealth for these very vulnerable personal issues.
I think it actually helps a lot of people. I think that, again, we talk about how we evolve. I remember when people first talked about telehealth or there'd be these companies out there that offer it and thinking I was such a skeptic. And what are they, how can you take care of patients without actually seeing them in your office? And that's crazy. And obviously, for me, I recognized it even before COVID. It was something that I was looking to get more involved in even long before COVID as a um, um, being able to provide more access to patients. But I think that people have become more comfortable with video type communication, whether it be with a doctor or just friends. Um, and I think for some people, there is a safety in it. People can be in their own home and be in their own comfort zone and not in a sterile office setting where there's maybe other patients in the room next door or other people in the waiting room or I think that that actually can improve their ability to feel comfortable and open and honest. And, I think about, therapy offices when people would have to sit in a waiting room at a therapy office and think, oh, now, of course, the other people in the waiting room are there for the same reason too. But yet there's that self consciousness of like, what do they think? What do I think? Etc. Well, if you're in your own home and you don't have to worry about what anyone else thinks, nobody else is there. And so
Right.
nobody knows If you're talking to me about your sexual health, if you're talking to me about menopause, if you're talking to me about your bladder or what you're talking about, because it's just between us. And so I think that it allows people to be comfortable, whether they're sitting on their couch or sitting on their bed or sitting at their desk or in their backyard or whatever it is, they can be where they feel best. It also allows me to have more access as far as flexibility in scheduling. I may have a standard schedule, but I also can work with people. And I recognize that everyone has different work life balance and work life situations where maybe our traditional hours of being in an office just don't work for them. And I can be flexible because I don't have to be at the office. We can find a time that works in someone's schedule to make sure that they're able to continue getting their care and not missing follow-ups because they can't take the time off work to follow up. And that's important. People have other responsibilities and it's not always reasonable to miss work or to miss their kid's activity or picking their kid up from school or whatever it is. And so having that flexibility, I think opens access.
Good.